Welcome to this session on the local government response on elder abuse. I'd like to start by acknowledging the traditional owners of the land on which we're meeting, the Gadigal people of the Eora Nation, and their elders, past, present and emerging. This session had its origin in the fact that for the last 3 years, I'd chaired the Age-Friendly Advisory Committee for Lane Cove Council. We've just finished that 3-year strategic plan. During that 3 years, we became a member of the World Health Organisation's global network of age-friendly cities and communities. And we've been very proud of the changes that have happened over the last 3 years to make the Lane Cove Council area a better place for older people to live, to work and to visit. And we had a session on elder abuse last year, about the middle of the year. And Professor Sue Curl, that many of you may know as a leading geriatrician who's had elder abuse as one of her priority areas, was one of the speakers. And I asked, what could we do in Lane Cove to make elder abuse less of a problem? And I found it really interesting that she immediately started talking about the work that Kiama Council had done. She had a relative who had early dementia, and the work that Kiama Council had done in making that area a much easier place for her relative to negotiate, to operate in, whatever. So that's where this session started coming from, of thinking about what can we do at that local government level to change things, to make things better. So that's sort of where this whole session came from, where I was then starting to look at what local councils were doing, who was doing things well, who might just be starting doing things, but they can talk about the problems that they've run into in starting things off, because that's where we can all learn from, because we always have problems in modifying things, making them right for the local environment. So with that in mind, I'm going to ask Nick to speak first as the reason why we're having this session, and then the other speakers in the order in the program. So Helpline with Shelly, and then 5 different councils, some of whom have been using the Elder Abuse Helpline resource, template and resources, some of which have done their own thing. And we'll hear from each of them for 5 minutes, and then hopefully have at least 10 minutes for a general discussion and response. Thank you.
Is it morning still, or is it good afternoon, everyone? That's a nice introduction. You've helped contextualise why we're here, or why I've been invited to come along and just speak very briefly. Okay, lovely. So obviously dementia is an issue that cuts across all communities. Kiama has tried to do some work in this space. In the context of this conference, I guess it's about looking at the social implications of living with dementia and trying to shift some of the attitudes in the social environment to be more inclusive, and obviously that can have an impact on people's perceptions and behaviours and responses to other people living with dementia. So the project is a partnership with a whole range of organisations over the last few years to help fund the actual project. So why was Kiama chosen for the partnership, which is a partnership between Alzheimer's, well, it was Alzheimer's Australia then, the University of Wollongong and ourselves as the council and the community? Well, because we'd started moving down this age-friendly space a number of years back. Kiama is also a member of the International Alliance of Age-Friendly Cities. So when Alzheimer's Australia and the University of Wollongong were looking for a partner to try and test out some strategies to try and make a community more dementia friendly, they came and approached our council, and of course we jumped and grabbed it with both hands. So I've mentioned the different partners, but the project is really focused on the social implications of living with dementia, because historically dementia has been approached from a medical standpoint where it's the professionals with the power to decide what are the issues and how we address those issues. And they've very much ignored the social implications of living with dementia. And that has, emerged through our project. We've all been, myself included, started from a fairly low base in terms of understanding, so it's been a journey for all of us very much. But it's been about looking at those social implications, about looking at enablement, what we need to do to support both physical and socially in the environment to bring about a shift, and seeing the rights of people living with dementia within the framework of disability, as in the rights of people living with disability. I could talk for hours about it, so I'm trying to make it succinct. But the things that have really worked for behind why it's worked in Kiama is we really do have a set of shared values and a shared philosophical approach to about what we've been trying to address. So understanding the importance of giving the voice to the people we're trying to support and make some difference with, and that is people living with dementia. And I think there's a message there for anything you do in the social sphere, whether you're working with young children, whether you're working with young people or whatever. You've got to go to those people and go, what are the issues, what are the priorities, and how do we address them? And anything that has other people doing it for them, to them, then you're bound to fail, at least in some areas. Okay, right, here we go. So we've been looking at the social implication living with dementia from the perspective of people living with dementia. The other points of success is one person sitting here on the end, Melissa Andrews. She was our project officer for a couple of years, and she was amazing. But having good people in the right space doing the right thing, having good mentors, Kate Swaffer, international advocate for people living with dementia, was a key involver in the project. The university were amazing, the way they helped structure it and do pre and post surveying, etc. But the project's been allowed to grow and evolve where we got traction. So we didn't have preconceived ideas too much about what we were going to do. It's really the main point I want to make today is about having people with dementia at the centre of and advising what we do, and that's how we've done it. And I'm missing a slide, but never mind. I was going to show you the structure where we had people in the advisory group deciding what are the issues and how we address them. So that's how we've shifted attitudes and behaviours towards people living with dementia, and it's really wonderful to hear quite an independent perspective that there has been a shift, and the university certainly measured that shift. So thank you.
Shelly from the Elder Abuse Helpline and Resource Unit.
Thank you very much. I'm really happy to be here, and for all of those that have attended, I had the pleasure of attending all of the conference so far. It has been such, an inspiring experience, and really looking at the headline or the tagline of Together Making Change. For me, at the Elder Abuse Helpline, certainly when we work with collaboratives in local government areas, that's exactly what it's all about. My colleagues are actually in the other room discussing the model of collaborative practice that we've evolved and developed at the Helpline. I'm today just going to share a little bit about in practice, what does it mean? How do we help and support local governments? I have 3 wonderful colleagues who I work with, collaborate with, who will be talking about their own council's role and how they're really, taking the issue of elder abuse and putting it on the agenda in their local government areas. So we are a helpline and a resource unit, so we do equal roles. I'm also a training manager, and I deliver training across New South Wales as well. I recently, in the last year and a half, sort of took over the role of working with local collaboratives. So that's those that are existing and those that are new, or certainly those that are expressing a need and a desire and a want to do something in their local area. So I don't think it's ever a lack of passion or interest or recognition of the prevalence of elder abuse. It's like, how do we mobilise locally? How do we develop effective responses? And I see the role of council and local governments as quite a key role and pivotal role in how they can actually really take a lead in the community, and really give permission for us to have this very important and very difficult conversation, because of course when we want to engage people and raise awareness, you know, elder abuse is not the way we're going to do it in terms of attracting people along, but we're certainly looking at how do we create that message, and as collaboratives, and each of councils may do it in slightly different ways, but what we do is provide resources, for example, a collaborative guide to setting it up. I actually attend, where possible, the collaborative meetings, so that we can really drive action and respond quickly. So how I see our role at ERU is to really help build capacity across New South Wales, and we cannot do that alone. It's how do we mobilise and how do we do it quickly and effectively, and so we try to make it as easy as possible for those that are wanting to do something. So for example, there is a guide. There is many other things that we can do. We have a lot of resources that we can share so that you can generate, because one of the key things we find is having key messages out there so we can address confusion that exists a lot of time for service providers in what to do when they do identify. I think I'm going to just briefly speak to what I see as how councils may take a lead based on my experience so far. But I think obviously with the ageing disability strategies, with the positions that exist within councils, you know, there's a real opportunity to drive elder abuse, to have that throughout senior, you know, strategic planning in the ageing disability action plans, being actively involved in or actually taking the lead on a local collaborative, leveraging council-run events, being early identifiers. You know, we do a lot of work with seniors and other members, younger populations too, and how do we actually plan ahead, prevent things, and provide the information which ultimately empowers older people to prevent themselves from becoming victims. Even things like sharing our resources. We have a lot of resources that could be at libraries, for example, where everyone, you know, a lot of older people might go in those settings, and people being aware of the role they have in maybe identifying something that they see and how they can act. We also look at, as well as providing resource supporting, guiding, we can give you any resource that you want in any number of quantities to help you raise awareness in your own local area. We also recognise the variety in local government areas with different ageing populations and what local government areas want. So we also co-create and co-develop resources, and I just wanted to quickly share on my final note just one example of what we've done this year, which is, you know, the need for local service providers to have a really easy little foldable card that they carry with them, which just has the abuse types. It has what is the response, what is the pathway, and then importantly, local contacts, who to call. And I think council could lead the way in making sure that all local key stakeholders are a part of that collaborative, because if we have police, if we have carers, if we have dementia support groups, if we have legal, and if we have and health, of course, as part of that discussion, then we can do a lot. I could go on and on and on, but I just want to express to you, if you want any more information or you're interested in finding out how we can support you, please come and see me. Thank you very much.
Thank you. We're now going to hear from Mary from the Inner West Council, who's going to talk about the collaborative work that's underway there.
Hello, everybody. I work for the Inner West Council. It's an integrated council comprising of 5 wards. Just for the context, it doesn't necessarily marry to the aged care map, so it's the Ashfield, Marrickfield, Stanmore, Balmain, Leichhardt, so it's a very large geographical area. I'm in a community development role. I suppose the beauty of being in the Inner West is we are able to collaborate and do cross-council work as well with colleagues who are here in the audience, such as Burwood, for example, and we work in a very collaborative way and in partnership. There's been, when I started the role, there was a very active aged services interagency, for example. So just a bit about our council, our vision and priorities. As you can see, we're the land of the Gadigal and Wangal peoples, whose rich cultures, heritage and history we acknowledge and respect. We're very inclusive, we are passionate and creative. We have a lot of artists living in the area. We have a very high population of LGBTI outside of the City of Sydney. And we have a very high population of people from multicultural communities where the languages that are spoken mostly outside of English are Mandarin, Cantonese, Italian, Greek, Arabic, Portuguese, Spanish and Nepalese. So the vision and priorities that Council has are around social vitality, creativity and quality of life. But obviously all the other things that people associate with councils around the built environment, planning, transport and all of those sorts of things. So what I want to talk today about really, what I want to highlight is how, with the language of council, which I'm still coming to grips with myself because I've only been there not quite 2 years, the strategic planning, how we can embed elder abuse into that language of council. And is it a hard sell? What do we need to do? How do we need to frame it? So it's around civic leadership. We know it's about service provision, it's around policies, it's about partnership and collaboration. It's about responding to community needs. Council consults, as we just heard from Kiama. It's about keeping in mind all those drivers around age-friendly communities and the healthy built environment, or a built environment that acknowledges the importance of providing community space and not just physical activities and transport and roads and rates and rubbish. So we in that context, we have elder abuse. So some of the key partnerships and programs that Council is involved with is around the working groups that come out of some of our forums that we convene, such as the Aged Service Interagency, very active domestic and family violence network, some of the funding we get to run some of those projects and initiatives. We also do a lot around the positive ageing space, and I suppose in terms of addressing ageism and the work of councils, it's very important to acknowledge that we do still run a lot of free and low-cost activities, health and wellbeing programs, and I will get to our collaborative, but it's very new in a moment. But the free and low-cost activities that we run, which build resilience, help friendships form, improve health, all those sorts of fantastic things, such as we have a women's shed in our area in Dulwich Hill. We run a range of art and craft groups. We respond to the community needs, such as the recent Rainbow Roundtable consultations, and have just established using a meet-up model for older LGBTIQ residents because of loneliness. We have a multicultural dementia forum that we host every year with Burwood Council and lots of other collaborators. We also have got a dementia dance group that we've just targeted to people from the Vietnamese community, and we have a cyber seniors group, and where the students teach the older people anything they need to know about any technology, and we have a dementia cafe in Marrickville and in Leichhardt. So we have a range of fantastic programs. And we also have a range, we also have many committed people who, before I started, had attempted to establish a working group or a collaborative, if you like, around elder abuse. I think it was before the more recent interagency policy. So what did we do? We sent out an expression of interest. I was approached actually by a couple of key players, somebody from Canterbury Community Centre and another agency, saying, how about it, you used to work at the Helpline, you've got a passion for elder abuse, why don't you set something up? We've got Health, Uniting, quite a few agencies involved, and they came to the first meeting. Some training was run. for them. We've diminished in size, but we do have a core group. So we're still at the stage of grappling with our terms of reference and what we might do. We've gone from a very big draft action plan to really pare it back. I'm not actually the chair. Health and Seniors' Rights are actually co-chairing, but I am there in the background helping convene the meetings. I can wind up. So we thought it was really important to get going quickly. We're working with the Domestic and Family Violence Committee, who are sort of still, I think, possibly scratching their heads a little bit, because it's usually those meetings are made up of people that work with families and young people and children. But we had a stall at the White Ribbon event anyway, which was wonderful. We've done some targeted training for members, and our action plan very much says that we wanted to become champions, and we want to look internally at our own organisations and our own policies, and we also want to develop an Inner West interagency protocol with a network map of services and referral pathways, and develop some local resources, make sure that any resources that the council develops also talk about elder abuse services, and also do a bit of mapping around what activities are on in the area where we can promote elder abuse and do some more prevention work. And recognise that our community is very multicultural and that we need to address the residents' needs. Thank you.
Thank you. Sorry to cut you short, but our time is so tight. We're now going to hear from Peter McGrath from Lake Macquarie, so we'll get a regional perspective of issues. Okay. Well, I suppose we've already had a regional perspective. Yeah.
Okay, good afternoon everybody, and thank you Margaret for the opportunity to be here today. Firstly, I'd like to begin by acknowledging the traditional owners of the land on which we meet today, and also like to pay my respects to the elders past and present. I am the Ageing and Disability Officer for Lake Macquarie City Council. I am also an active member of the Central Coast and Hunter Collaborative. I've been in my role for just over 2 years, and I've been in the sector for 11 years. I started as an activities officer with a community organisation, and I worked my way up to be a senior coordinator, 300 clients, volunteers and staff, and boy did I have my eyes opened being in this sector. Enjoyed every moment of it, but yes, having dealt with my own personal experience with elder abuse in my family, yes, it does happen, and yes, it can happen to your family. Lake Macquarie Newcastle Community Care Network, and we partnered with New South Wales Elder Abuse Helpline Resource Unit. We put an expression of interest out to the community into the ageing services and said, let's do something. And that's how the Central Coast and Hunter Collaborative started. We're a group of dedicated professionals who are committed to raising awareness of elder abuse in the local community and improving response pathways between local services and agencies. We meet, and then we also have a distribution list, because as we know, we're all very time poor and getting to different meetings is very hard. But we have that list and everyone gets our information and it's there. As we all know, we are all living longer and the population is ageing, and Lake Macquarie City Council has committed to employing 2 full-time staff who are part of the Community Planning Department. We have a community planner for ageing and disability, and then my position as the Ageing and Disability Officer. Part of that role is to provide information to the community, including appropriate support services. As we know, council is not a direct service provider. In partnership with the Elder Abuse Helpline Resource Unit, we all work together to raise awareness, to empower our community and deliver key consistent messages to the community and the sector. As Shelly showed you, that little A5 brochure, that we work together to do that. We have our own brochure as well, and my position on that is the contact for our community. We're working together. I think it's really important that we know that we all have so much resource out there, but as one we can make a difference. Instead of the council doing this and the helpline doing that and everyone having a little bit, if we pull it all together, which is what we have in our community, we can be a stronger force and we can really make a change. Margaret, you said about problems and how we've been going in our collaborative. We've only been a new collaborative. Teething problems, I think we're pretty strong as what we're doing out there, and we're still going. Like, I think sometimes people start things and it just fizzles off, but not with us. We're out there, we're in the community, and we're stronger than ever, and we're really excited about International Day that's coming up, or National Day that's coming up, and we've got some great ideas, and we're not going away. We know this issue isn't going away, so as the theme for this conference is Together Making Change, that's what we're doing, local government and the collaborative all together. So thank you for letting me be here today. Thank you. Thank you very much.
Okay, we're at least getting someone from outside of New South Wales. So Michelle Penney from Knox City Council in Victoria.
Thanks, Margaret. Thank you. I too would like to just acknowledge the traditional custodians on the land in which we meet today and pay my respects to the elders past and present. What I'm going to talk about today is a family violence project that Knox Council has commenced recently, and I also want to include in my content just some existing strategies that we use to support our older community, which is based on more of an upstream approach about looking at healthy ageing for everybody in the community, not just those people who are susceptible to abuse. So just to give you some context, because it is outside of New South Wales, the city of Knox is 25 kilometres southeast of the Melbourne CBD, has a population of around 160,000 people, and 15% of our population are aged over 65, and 13.4% of the people over 65 speak a language other than English. Unfortunately, within the City of Knox, family violence is a significant issue, having had the highest rate of reported family violence incidences in Melbourne's outer east for the last 20 years. For this reason, along with the findings from the Victorian Royal Commission into Family Violence, the councillors at Knox Council committed to a municipal response to family violence at both a strategic and a grassroots level. The family violence had a couple of key areas which I wanted to focus on, and they were the need to improve the services for victims, strengthen early intervention, hold perpetrators to account, and engage in primary prevention efforts to address the attitudes and behaviours that lead to family violence. Some of the things that we found when we started doing some research for the project was that we did find that elder abuse reporting rates had increased in the last 2 years from 4.2 to 6.2%. While that was good, the reporting rates were increased. Again, what we've talked about a lot at this conference is that the data was not really strong, and the information we got from hospitals and courts around family elder abuse within the City of Knox unfortunately only categorised everybody in one group over 45 years. So we don't really know if that's somebody at 46 or someone at 86, so that has been a problem. Because of a whole range of factors, including those, the older people are one of the key priority groups in the family violence strategy, with a strong focus on people from the COLD community. So what Council has done so far is that we've developed a regional family violence partnership with our other local 6 councils. We've developed a multicultural language poster which is entitled "Culture is no excuse for abuse." And we have a strong multicultural area in council that obviously recognises the nuances of working with different COLD communities. But we did want to push the point to say it doesn't really matter. Abuse is abuse, regardless of what your culture is. We're also participating in a program called Matter of Trust, which is focusing on financial abuse. And for this program, we're working really closely with our local Chinese communities. And I was just going to give this a plug. The Eastern Community Legal Centre are here as well at this conference, and they're presenting more on that Matter of Trust program this afternoon, if you would like to go along and have a listen to that. In terms of existing initiatives, we have a very strong age-friendly team that focuses on the contribution of older people in our community, like lots of people here have already said. We celebrate Seniors Week, but we don't just do it for the week, we actually do it for the whole year. We're involved in a whole range of WEAD activities, both inside and outside of councils. Victoria has a program called 16 Days of Activism, which each local council takes up for 16 days in the year, and we dedicate one of those days specifically to elder abuse. We have strong community representation on council's advisory committee, so our active ageing and multicultural communities in particular. We are about to commence a data recording project with Eastern Community Legal Centre so that we can get better data around elder abuse in our community. Council is a member of the Regional Elder Abuse Network. We have an active communities department which also works very strongly in collaboration with our local community groups. We've recently updated our elder abuse policy for our staff, which we're focusing more specifically on some of the more vulnerable groups, and with some really kind of quite detailed information about how to support vulnerable groups. At a CEO level, elder abuse has now become a key priority area. The CEOs in our local area were really keen to try and say what were the emerging issues for the community, so when they had opportunities to lobby at a higher sort of level for legislative change, that they could do that. So we were really pleased that elder abuse became one of their priorities. Our council undertakes life stages planning across the whole of council, so it's a more integrated response to planning for council services. So rather than saying what do youth services do, what do children's services do, what do aged services do, we actually apply a life stages lens across all of it. And that allows us to focus on the impact of council services for a whole group of people, and also gives opportunities to look to see what other changes that we can make within council. And we've also just started to use our leverage in our planning approvals process. So we recently had a large developer who wanted to come into the Knox Council area. So council was able to negotiate for integrated amenities, and one of the things that they have put into that project for the developer is that they're going to be building an intergenerational playground. So it actually supports that intergeneration connection between people. I think my time's up. Yeah.
Okay, our next speaker is Prue Hardgrove from the Blue Mountains City Council.
And it goes. Can I just say, I'm so impressed with all of the things that other councils have done. I think, can we just have a round of applause for these amazing people? Try to be multi-skilled is a bit difficult. Okay, the key thing I want to get across, which I think all of us have all said in different ways, is about collaboration. But I guess for Blue Mountain City Council, it's about the internal collaboration that we have in particular. So whilst most people think, and this is true, that council is about roads, rates and rubbish, that can actually be an advantage, believe it or not, in the community services sector. So here, just to give you a snapshot, like everyone has said today, we too have an ageing population. I think that graph is self-explanatory. Like as well, the Inner West is also a high LGBTI community. As a result of that, our council last year developed an ageing strategy, as most councils have done. The achievements to date in terms of elder abuse, we've established our Elder Abuse Collaborative in 2015, to which colleagues of mine are here today, which is fantastic. We've developed a draft resource kit for services. We've conducted presentations and morning teas on elder abuse to view clubs and carers groups. We've also done representations to various other community care forums and morning teas and the like in the area. I'll just snap to the next one so that just gives you some information. We've hosted in partnership with the Elder Abuse Resource Unit Awareness Days as part of the Elder Abuse Day, International Day. We've also facilitated case conferences on elder abuse with the collaborative to ascertain a way forward to assist the older person. Okay, where to from here? We're currently exploring the appointment of an ambassador. We're developing a logo for the collaborative, and we're development of an A5 resource card. Okay, in terms of local government's role, obviously it's coordination of our collaborative in partnership with the Elder Abuse Helpline and Resource Unit. We're a resourcing role. We also have an advisory role in terms of funding opportunities, an advocacy role to the state government, an awareness role and input into state government inquiries such as the recent elder abuse inquiry that was held in March 2017. So in the final points that I did want to make, we, like other councils, have Seniors Week events. We have a month of events. We don't have a year of events. We have a month of events, of which we've got this upcoming April, a Planning Ahead forum on wills and power of attorney, of which Daryl Brown, legal solicitor, is here today, I believe, co-hosting a thing on elder abuse. Also, too, we have a domestic squalid hoarding working group, which I headed up in 2009 because I saw the need of people to have assistance with elder abuse. For example, we had a lady who resided in the Upper Mountains who was $16,000 in arrears with her rates. She also had hoarding and squalor, what have you. She had intellectual disability as well as dementia. I, with the rates and revenue team and the health and building surveyors, were able to have a meeting with themselves and with the external partners such as ACAT and Dementia Advisory Service to say, well, this woman's got $16,000 in arrears in her rates. How can we prevent people like that getting in arrears with their rates? So we actually worked with them and the Guardianship Board to assist them so that now we have in place, if anyone comes into council who might have rates in arrears or hoarding or squalor or there's potential abuse by the ACAT team, and as they ring me as a mental health team, and I in turn liaise with my colleagues, the rates and revenue team and others to assist that person to look at how we can remunerate those rates that are in debt. And in turn, we have like a hardship policy as well to assist people so that they don't get charged the interest on the overdue rates that they have. So thank you.
And our last speaker, Melissa Andrews from Shoalhaven City Council.
Thanks, Margaret. How long do I have? 30 seconds?
Time's up now.
So, hands up if you've been to the Shoalhaven. Okay, those that didn't put their hands up, you need to come. It is one of the most beautiful places in the world, and I wish I brought you a photo, but if you can imagine the whitest sand in the world, it's full of national parks, beautiful natural areas. So we're a really big LGA in terms of size. We've got 49 towns and villages as part of the Shoalhaven, which is a real challenge for us. As you can imagine, that creates a lot of isolation for older people. So that's something that really challenges us across all levels of council. But when we're talking about elder abuse, isolation, of course, increases the risk. That's right. Thank you for whoever said that. So our role. So our first priority in our community strategic plan is to build inclusive, safe and connected communities. And I think that priority can really inform the way that we work in the elder abuse space. So, what are we doing? We are, like all of these other councils that have spoken, very actively involved in our local elder abuse network. We provide aged care sector support, and a part of that is promoting the elder abuse resource units resources. Something that we've just collaborated to create using the Elder Abuse Resource Centre's resources is this local pamphlet for service providers to direct them to local responses to elder abuse. So we're going to be heavily promoting that. That hasn't been launched. We're going to launch that during Seniors Festival. Seniors Festival calendar of activities, that's a really big thing on our radar. I didn't mention earlier, we have one of the highest rates of people over 60. So we have more than a third of our residents are over 60. So that is a challenge, but it also makes us really, really privileged. So we do our best to make use of our older people as a resource in our community. So our community, I'll go to the last one there, no, the other slide. Our community consultative body. So I mentioned that we've got 49 towns and villages, and how do we hear from the people living in all those towns and villages? So we have, in most of those, or the bigger ones, we have community consultative bodies, which tend to be made up of older people. So that's how we hear their voices. That's a way for them to get connected with each other and tell council what they need, what we need to do better, and how we can better support them. One thing I'd like to share with you is about the activation of our community places and spaces. So I mentioned that we have a beautiful natural resource down there in the Shoalhaven. Down in Mollymook, right on the beach, we've just created an inclusive playground. Now that's all inclusive, so that's all ages, all abilities. And that's a model that we're hoping to roll out across the Shoalhaven. So building our parks, building our community spaces to be accessible, which will mean it's easier for older people to come and be included in what the rest of the family are doing. We're also looking at our beaches. So how can we make our beaches easier for older people to access and come down and spend time with their families? So I guess that's combating ageism, and it's combating isolation as well. So that's some of the practical things we're doing. And I'm going to finish up now so that you'll have time to ask us some questions.
Thank you. When I spoke with the panel members last week, everyone has agreed to be available if people want to ask questions, share understandings of what's working, what isn't working, etc. So I do urge everyone to, over lunch or some other time, follow people up, ring them up even, and get some more advice. We're tight for time, but I think 2 questions would be reasonable. So are there any 2 people who wish to avail themselves of the opportunity to speak publicly?
Hi, I'm from the Mid-North Coast Community Legal Centre in Port Macquarie. Just wanted to, really excited, Prue, about your noticing the issue around rates and, you know, the rental rates arrears and what that has an impact on. I know a lot of councils have got a tendency to go straight to court with rates arrears. And I would just like to ask whether, you know, you guys as council workers and staff are able to liaise in the way that Prue has done, because I think that gives you a really an immediate impact, really, or what's the word? You know, insight into people who are experiencing abuse, and maybe can help delay some of those compounding factors of debt. That's how we see people come to us, is through debt, and often rate arrears. So yeah, is there a chance?
Yeah.
I know at our council, I've only been there for 12 months, so I can only tell you what's happened in the 12 months, but I've definitely had a number of calls from our rates people to say, we've noticed something different. You know, Lucy's been paying her rates for the last 20 years and all of a sudden she's not. So what can we do? Can we contact her? How can we check out what's going on? So I think in that case we got Red Cross to give her a call and see what was going on.
I haven't had a rate. I haven't had an issue with rates yet, but I have had a number of calls from our health and safety people because my position sits in community services and culture, and they've been really trying to not have to go to court, and we've worked collaboratively with a lot of, including internal people and other external people, and it did get to a point with one particular matter with an owner whose roof was collapsing, and he was very, very, very vulnerable. But I was standing on Parramatta Road with the Greek welfare counsellor on the phone, ready to talk to him, and we had the homeless range of services visit and you know, working with the family. So they really didn't want to have to go down that path. But it's about the danger as well. So I was really, really impressed, and they've come, and so have Fire and Rescue and a number of other sort of services and internal people do call us, wanting to find a sort of a resolution that's and get some help for the resident, which is wonderful.
Okay. Is there another question?
The councillor from Kew, I'm very impressed about the intergenerational playground men sheds being included in the DA requirements for developers. Not sure whether that's working. Is that extending further in planning provisions to include disability access as a matter of course in all new buildings, which I'd like to see throughout Australia, so that when people go into housing, they needn't modify it if something happens in the family. There's no good reason why we can't have wider doorways, for example.
I think that's a really good point, and I think the example I used about the intergenerational playground was it was a good faith negotiation with the developer. Our council has had difficulties, and I'm sure other people have experienced this, where council certainly has a minimum standard around things and they put things in addition to legislative requirements. Often, unfortunately, though, we have had the experience of things go to VCAT, which is our administrative tribunal, and it gets overruled. So at this point in time, our council is trying to negotiate in a good gesture way with developers. And on this particular project, the developer had something that council had that they were prepared to negotiate on. So while we are very mindful of it, and council certainly has in its planning process things like disability access requirements on a whole, and including targets around social housing that are above and beyond what state government legislate for, it doesn't always come off the way that we'd like it to, but we are certainly conscious of it and aware of it.
Thank you. Thank you to everyone. Would you join with me in thanking all the participants?